Are live and ready to go. So, thank you everyone once again for joining us today for our sixth Cheetah Chat.
Yeah,
This
good
is
morning.
our sixth one total, but third in our series about diabetes management. The previous days we talked about just general diabetes management and as well as healthy eating on a budget. So today we are just talking about managing diabetes and how it can present some challenges, but that's okay. My name is Kyle Shavasta. I am the public programs manager here at the Community Health Training Alliance, a program of Philadelphia Fight Community Health Centers. And with me is my lovely colleague.
Oh, thanks, Kyle. Hi, everyone. My name is Dr. Tashina Reeder. I'm the director of the Community Health Training Alliance. And if you've been hanging out with us since Monday, you've already met Miss Kim Lawrence, who shared about managing diabetes. And yesterday, you met Miss Teresa Sullivan, who spoke about um, healthy eating and how to be creative in your meal prep and accessing food while living with diabetes. And so today is our last day of our diabetes series. And today we're going to look at more of managing diabetes, how managing your diabetes can be hard, but it's okay. And I think that's a great topic to end on, considering tomorrow is Thanksgiving and we're going to be
Mhm.
surrounded by lots of food and people want to indulge, of course, but you have to also be mindful of your diabetes. And so let's start there. So let's start with, we say that, managing diabetes can be hard, but it's okay. What does that mean?
So for me, being a diabetic for over 20 something years, I've had my ups, I've had my downs, far as trying to manage it in a way that my doctor wants me to. And this sometimes it just gets kind of difficult, especially around holiday seasons and, being around other family that eat a certain kind of way, and trying to stay on that right track, like being real mindful that I am a diabetic. I need to eat a certain way. And keeping in mind that even if I slip up, it's okay for me to have that small slice of sweet potato pie right around this time, and like just keep monitoring my sugars and staying connected to my doctor. But I always say, and I always say this about diabetes, that if things are done in moderation, you don't want to punish yourself to the point where you are not enjoying the foods that you enjoyed before being a diabetic. You still can like switch up. And one of the things I do is, especially with sweets around this time, because Thanksgiving and Christmas, there's pies, there's cookies, there's cakes, there's ice cream, um, a lot of sugar. You can substitute with the sweetened sugars like Splendor. I did that last year with sweet potato pies for myself, and it tasted fine. It was, you can really tell. So just being really creative about what you want to eat, and like keeping in mind that you are diabetic, and if you do eat something, do it in moderation, and that's okay.
Okay.
Well, for me, I just already said in my mind, tomorrow's going to be a cheat day for me. I'm just going to cheat tomorrow. And then, and of course, as Teresa mentioned, I'm still going to, do everything in moderation. I'm not a sweet potato eater. So the sweet things of the holidays don't really bother me. It's the not having that Pepsi and the chips and dip, that type of thing. I'll have some, I won't have as much.
Hmm.
But I just made up in my mind, okay, it's a holiday, I'm going to eat. And then, you know, come Friday, back on board again.
Okay. That's good to know. I know that we were saying early on during Monday that, I'm thankful that you guys are sharing your lived experience of diabetes. And I know people love to hear from folks who are walking the same experience. And so um, I'm thankful for your transparency and sharing that, I'm going to cheat tomorrow, but I know I have to do it in moderation. And
Hmm.
Teresa saying, hey, I'm creative with how I cook and eat. I use Splenda, right? Of a different way of eating something sweet. And so, and I'm glad that you mentioned that it's okay, because I think sometimes we can be um, not so much hard on ourselves, but almost a form of fear like fear of the illness. And so we become very rigid and the way in which we live. Not saying that it's a bad thing, but I think your message is it's okay that it won't always be perfect and you can still enjoy food, but just be mindful of how much you take in.
Mm-hmm.
Um, to manage, your sugar. Now, question, with that, I know is about a part of it, managing your diabetes is accepting that this is what it is. This is my life now, right? And so, hearing you guys talk about the holidays, is it wise or is something that should be done where people carry with them something to monitor their sugar throughout the day in case they,
Mm-hmm.
I don't, what do you
Yeah.
recommend?
That's a great question. Because for me, which I'm a little different than Kim, um, I have a monitor attached to my arm, a sensor, where I can even like if I'm out and about, if I'm at the supermarket and I'm not sure and I need to check my sugar, I can do it with my phone. And when I'm home, I have a small little monitor that I just can like check as often as I want to monitor my sugars, especially if you're deciding to, which I don't recommend that you be in several households be together this year because of COVID-19. I recommend that if you're going to do that, wear masks, space yourself out. But a lot of people are choosing, and people are tired of not seeing their family, and I get that, right? Just make sure that you're taking your equipment with you. If you're a person who does a finger stick, make sure you have that. They come in these little cute little cases. I know Kim has one where everything's in it. It's a little zip little thing. It's really convenient. Or you can ask your doctor in the future for Christmas, not so much now because Thanksgiving's tomorrow. If you choose to get a monitor done on you, mine is the freestyle monitor where I can check my sugars anytime I want to, and my machine records it, so I don't have to write anything down. And I have a link that sends it right to my doctor when they need to look at it before my appointments, whether it be telehealth or doing a walk-in. It's up to the individual. It's a personal choice of how you want to make sure that you're monitoring yourself. But if you are going to travel this year, make sure that you're taking whatever kind of monitoring devices or finger stick equipment. Make sure you're taking your medications with you if you're traveling to other people's homes to eat. You want to make sure that you're staying, as best as you can to what you do if you were at home and monitor yourself.
Well, for me, as Teresa mentioned, we're both different in the level of diabetes. 9 months, I would say 9 months, I have been managing mine when I found out. And because my A1C is not as a level that's quite dangerous as the doctors say, it's a little bit easier for me. Like I'll do my finger prick probably, as I always do, morning and then
Mm-hmm.
in the evening. I don't usually carry it with me because I usually do it when I'm at home. And as I mentioned on Monday, my doctor even recommended that I really don't need to do it. I do it personally so that I can monitor for myself on a daily basis, what my glucose level is. And I still, like I said, it's only been 9 months, and my goal is to by time this time next year or before, I'm no longer on metformin. I'm able to control my diabetes, and the A1C level is down where it's not even pre-diabetic
Mm-hmm.
anymore, which where I've been in probably quite some time. I found out pre-diabetic,
Mm-hmm.
and it was when it went a little over to the diabetic level that I started really like, okay, now I need to manage it because I don't want it to go any farther.
Mm-hmm. That's a good point because I remember when I first was diagnosed with diabetes, my doctor, put me on metformin, and I was taking it. Everything went well. I had this more robust exercise I was doing at that time. Now, keep in mind, we're talking 20 years ago, right? So, my sugar levels went down, and my doctor actually took me off of the metformin. But throughout the years, not monitoring myself, not paying attention, not participating like I should in my health when it comes to my diabetes, because I had it in my mind, he took me off it, I'm good, right? And just ate anything and everything I wanted to. And the aging process came along as well. And then I found myself in a situation where I got really, really sick. This past December, I was hospitalized for about a week. And my sugar level was so high that you couldn't take it with the machine that you use, Kim, to prick yourself. It would not register. So they had to do this other procedure to find out how high was my sugar. And my sugar level was 1,242. My AC1 was 15.7. Uh, the doctor said if I didn't walk in that emergency, they don't know if I would have been here. So I'm really, and like fear was a factor for me that motivated me. I'm like, oh my goodness, I didn't know it was that. I knew I was really sick, but I was thinking it was because it was around the flu season, right? And I'm like, oh, I probably got the flu, it's gonna be okay. Thank goodness for my husband. He's like, nope, we're going to the ER. That's not you. You're just sitting in this like a zone. And because it messed with the way I was thinking and my concentration, because my sugar levels were just that high. So the fear factor, like, okay, Teresa, we got to get back on the ball. I let the doctors do what they need to do while I was in the hospital to get my sugar levels back down. That was in December. I am now currently at my A1C of 7, which is great, from 15.7. And from December to now is great. Um, I also insulin dependent. And I know that might be something that's going to happen for the rest of my life. And I just had to like get, comfortable with that. I don't like sticking myself, but so we talked about taking me off the regular insulin and doing the once a week insulin, which I'm on now, which helps. It doesn't take away my long acting shot at night. I still need to take that because while you're asleep, your sugars in your bodies is still doing and, running. So you want to make sure that your sugars doesn't get real high while you're sleeping.
You guys mentioned something that stood out to me. Two things. One, Teresa, you mentioned about being an active participant in your care.
Mm-hmm.
I think that's very important for all of us. And even if you have diabetes or not, being an active participant in your care helps you to be involved in, medications and your treatment and how you're remaining healthy and staying in communication with your doctors to make sure things are okay. But also a level of acceptance that, okay, I have this diagnosis and it doesn't define me or dictate how I choose to eat. Now, I have to eat differently, but I can still enjoy life even with diabetes. I think that's an important message for people to hear that. One, you got to be an active participant in your care. You got to be an advocate for yourself and make sure you're involved in managing it. But also doesn't mean you have to stop living. You can still enjoy your life and still enjoy food. You may have to do a little differently, but you can still live.
Yeah.
And I think that happens a lot when we get all these diagnoses, whether it's diabetes or other things that we may feel like a part of us is gone. And really that's not true. So we can still do it in a different way, right? Live a little differently. So thank you for sharing that.
And I think Kim would agree with me that, being a diabetic, first getting that diagnosis was frustrating. I was like really upset. I was like, oh wow, even though I know genetically throughout my family, I'm predisposed to diabetes anyway, but I didn't want to have it, right? But I was frustrated, but I just had to understand that this is part of who I am, and it doesn't define me. I define it, and I'm the one that can be in charge of how I monitor myself and take care of myself as a diabetic. Understanding that there's a lot of fear factor when you're diagnosed with diabetes from seeing people and seeing my own grandmother like lose part of her leg, and stuff like that. It's really fearful. And I didn't want that to happen to me. So that's again another thing that like motivates me. I don't want that to happen to me. So I need to really pay attention and participate in my care when it comes to my diabetes.
And I think the most important thing for me was, I guess I wasn't nervous or scared. I guess I was more so shocked. And I was even further shocked that I mentioned on Monday that this had been going on. The A1C had been high for a few years, but that the doctor never felt that it needed to be addressed. And then once I found out, because of a new doctor, I was able to address it to get it to the point where, as you say, Teresa, it never got to the point where I didn't even know it was high at that point. But for me, mine was like, okay, I have this, I'm going to beat this. And once again, I keep saying that because I do not like to take medicine. So for me, and then after doing a lot of research on it and talking to other people like you, insulin, and people that I know that had diabetes, and beat it. That I can beat it if I try hard enough. And if that first doctor didn't work for me, then I was going somewhere else. I know that happened to a friend of mine. The doctor told her, "You'll be on insulin for the rest of your life," and she was devastated. I mean, she was devastated that in thinking, and then not that at that point that I have it, but I knew of many people who did, and I'm like, no, I know people that got over this. So if you want to, you can. And like I said, mine was caught early. The highest of my A1C was 6.5, but I was able to get it down to 6.3 without medicine. So I know I was like, okay, if I could get it down without the medicine, then I know I could get it down. But the doctor, she wanted me to continue the medicine because diabetes, as you know, Teresa, affects other parts of your body. Right. And that's the part that they want to focus on. Like, okay, yeah, you need to get it down, but quicker than later.
So what I'm hearing is that, everybody's body is different.
Right.
Everybody's diabetes look different. Some people can change their lifestyle in such a way where diabetes is no longer an issue. And for others, it's going to be a part of their lives.
Right.
And they just have to manage it accordingly. So I think it's important for those who are watching to know that while some people can change their lifestyles and be done with it, right? There's some of us who can't.
Right.
So it's important to, be yourself advocate and participate in your care. But also, if you feel that I'm not comfortable with that diagnosis, you can always get a second opinion.
Right.
I think within our rights as individual, you want to hear from a different doctor, right? And then learn from there what you need to do so you can make a good informed decision for yourself as to what you feel comfortable with in terms of your care.
And that's a great point.
That's the most important thing, because we as African Americans, most of the time, we'll go to the doctor will give us a diagnosis, they'll give us one pill, and then they'll give you another pill that'll help you with the side effects of that pill. And before you know it, you're taking all this medicine and you're just like relying on the medical doctor telling you what you need to do, and we don't research for ourselves. I think that was the most important thing for me when diagnosed with diabetes is that, okay, I'm going to research for myself. I'm going to do what I could do or what I can't do, what I need to do, what happens at this point, and just not listening to the doctor. I've always been an advocate for myself, but now I'm even more of an advocate for myself. If a doctor prescribes something for a cold, what's the side effects? Do I really need to take this? Is it that bad? And I think that's the thing I want to stress from these chats to, especially those of African American Blacks. We need to advocate for ourselves. We do not need to always focus on the doctors just constantly giving you pills. At this time last year, I was on 5 pills for blood pressure, this, that, and the other. Today, I take 2 pills a day. Great. My goal is to take no pills a day. Whether it ever happens or not, I'm in charge of what can happen and what can't happen. So that's my goal, just like advocate, ask questions about medications. And then if you don't feel comfortable, because I quickly tell a doctor, I'm not comfortable. I don't feel like my health is at your best interest right now. I'll move to another doctor. And we can do that.
And that's a great point, Kim, because the person that runs an educational program for many years now, I always promote being part of your care is a partnership. It's not a one-way street. You don't always have to agree with your provider. You do have some say-so on what you will not, and willing to do. Right. And most people don't know that, and that's part of advocacy, right? Being in that partnership and not being that person just says yes to everything. Right. And as a person that educates about health, I know the advancements of medications and things that has pushed forward in our community now. There was a time where, yes, people had to, take certain things and monitor their diabetes a certain way. But now we have so many advancements that make your life so much easier. Right. And so making sure that, you're doing that research about what works best for you and what you're willing to do. Right. I'm not willing to stick my finger. I'm just not, if my fingers get really hot and I type a whole lot, right? So my hands get, I need my hands. So this monitor on my arm helps me, and it even actually helps my husband because if I go lay down and he's like, "What's wrong?" Right? And he'll come and he'll tap it just to make sure that I'm okay. Because sometimes with diabetes, you can feel a certain way, but your sugars are totally off the chart. So I just need, for me, I need to like be real mindful and checking my sugars when I feel a certain way. But my machine will tell me exactly where I feel. And if I need to do that finger stick, my machine will tell me, okay, do a finger stick so we can make sure.
So
And I
Cal,
can sit.
what are your thoughts, Cal?
Well, I mean, I am just impressed with the plethora of knowledge you both are spouting today. I am humbled right now. I think the fact that you both have decided to parrot what Dr. Reeder said, be active participants in your healthcare, is inspiring, and I think that's a really great message for our audience, that you can have a relationship and you can foster a healthy relationship with your doctor and be the driver in that conversation, in that relationship. Your health is your wealth, and you are the manager of that. I was supposed to talk about setbacks and successes. It sounds like you both have had a litany of successes in managing your diabetes. You made my job easy because you answered that question already, as well as discussing some setbacks. I actually have a clarifying question. A1C, that is the test that monitors blood sugar, correct?
Your glucose levels, which is sugar.
Mm-hmm.
Gotcha. And metformin is an oral diabetes medicine?
Yes.
Yes, it is.
Gotcha. And that can be taken sometimes with the insulin, sometimes you don't need insulin. It just all depends, correct?
Yeah, it depends. It depends on the individual and what that doctor might recommend at that given time with your diabetes. Doesn't mean that you'll have to be on metformin in the future, right? It's just to like get it down and so we're at a level where it's manageable a little bit more.
Gotcha. Thank you so much for that. And to our audience, just a reminder, always talk to your doctor about these things and what's best for you, as Kim and Teresa have done with their doctor, and they're kind of crafting a personalized medical plan. So what are some tips and tricks, as we go into this holiday season? I mean, you gave us so much today and the last few days. Like, what are, your parting tips to people who are working on managing their diabetes?
Well, for me, as Teresa was saying, a lot of sweets, and between Thanksgiving and Christmas, it's like, oh goodness, the cookies, the candy, those type of things. Mindful. I'm not a real candy person or cookie person or pie person. My thing is the cakes maybe. And like I mentioned on Monday, I always was watching the sugar, but really wasn't ever paying attention to carbohydrates, which are just as important in diabetes. So, the potato chips with that Pepsi, those are pretty much, I'll still eat my chip and dips tomorrow, but it won't be as many. I learned this trick from Oprah years ago before I was even managing. Stop eating out the bag and put it in a bowl and put that to the side. Before, I would just get the bag, the dip, and I'm going away. And before you know, it's like, okay, did I eat that many? But now I'll take a bowl for what I'm going to eat, those 2 tablespoons of dip, and when it's gone, it's gone. Those are some tips for me in managing diabetes over the holidays. Not just the holidays, on a daily basis. Don't eat out the bag. Don't eat out the container. I actually went out and purchased some special cups that show this is a quarter cup, this is a half a cup, this is a cup. So I measure those starches and carbohydrates in those cups. Then I know that I can still have some potato salad, but here's your quart. Well, tomorrow it's going to be a half. I'm not going to lie. It's going to be a half a cup. Yeah, that's it. So I think the portion control works great with just watching. Those one of the tips I'm going to use over these holidays, where we know food is in abundance all the time.
Those are great points, Kim. For me, the one tip that's really important is to be mindful of what your plate looks like. And I said yesterday, if your plate looks really gray and dark, You need to rethink what's on your plate. If you're going to go to a family gathering or you're staying at home, make sure that you are cooking bright vegetables, incorporating dark greens into that on your plate. Monitor your carbs. There's nothing wrong with switching from not having white rice to having brown rice, and spice it up. Because like I said yesterday, I like spicy food, and that's my weakness, right? So I make sure that if I'm going to have a certain thing, there's nothing wrong for me spicing it up and give it some flavor. So just making sure that you are having those greens, watch what kind of meats you cook. A lot of people around Thanksgiving likes turkey. I don't. I just don't like turkey. Not for a holiday. Cook lean meats. Make sure you are not cooking meats that have a lot of grease and fat to them. And you can do that. Turkey is a lean meat. I just don't choose to cook it. My husband, he'll grill outside, and or we'll cook our food a different way. Just figure out like things that are more healthier choices. But again, it's the holidays. If you slip up, dust yourself off with a feather and just start all over again. It's fine. It's cool, right? It's the holidays. We've been stuck in the house for 9 months now. And if you're having a moment of a sugar crave, go ahead, go for it. Just be mindful to monitor yourself.
You raise a good point. I think it's something to be said about that. It's probably a whole nother segment because, being home for practically almost a year people probably have grown bored and have these urges to have sweets because, we couldn't really get out and do much. Summertime came, some of us went out, some of us didn't, having this to monitor or just wanting to have the old way of life kind of feeling. You might feel nostalgic and say, I wish I could have some ice cream. And you might find yourself overindulging because you have been without it because of the way in which life has changed. And so I think it's great that message that you both are sharing, that you have some, but just don't overindulge and monitor yourself. But again, everybody's diabetes is different, and some folks may say I can't have ice cream because they may know that I won't manage it well because I love it that much. I just may overeat, so it's best for me not to have it.
We got to meet ourselves where we're at.
Exactly. Yeah. You can always switch from not eating ice cream to sherbet, which is better for diabetics in moderation because it also has a lot of sugar in it. There are a lot of products, and I know I get a lot of kickback when I say sugar-free products. I had to get used to those because I was like, no, this tastes nasty. Diet soda, ill.
They're not that bad though. They're not bad.
They're not bad.
Yeah.
I buy preserves because I like to have some toast, wheat toast, and a little preserves on it, and it's sugar-free, and it keeps my sugars from going really out of whack. And I start feeling like I have a headache all day long if that happens to me. So I just know I don't want to feel in a certain way, so I eat a certain way.
Okay. So Kyle, do we have any questions in the chat? Any comments about things that's being shared?
Not at the moment, no. But for anyone who's watching this now or watching this in the future, please put your questions in the comment section. We'll do our best to answer them. And just as a reminder, we posted today some follow-up resources that Teresa so kindly provided to us.
So make sure you check it out. It's on our Facebook page, right? So make sure you get that to look over it and save it and share it to people who you think would benefit from it. And so as we prepare to close out today's segment, any last words for our audience about tomorrow?
Listen, it's Thanksgiving. I know we've been locked down for a long time. Give yourself a break. Enjoy your holiday. Don't beat yourself up. Just get back on that, on that regimen that you're used to after the holidays. You'll be fine if you do things in moderation.
Right.
And happy Thanksgiving.
And I agree with Teresa. It is the holidays, and I'm going to eat everything that I cook. I'm going to eat it in those portions that I know that I need to eat.
Give her portions.
One piece of ham, tiny piece of ribs, and half a cup of potato salad, you know, those things like that. And like I said, for me, it's the, you know, if I'm gonna have that much starch with my dinner, then I know for the dessert time, it's like, okay, Kim, now you can't have that for dessert.
Right.
You know, so I'm gonna enjoy myself, but I'm also gonna be mindful that I am managing diabetes, and I don't want to go back. And
Right.
for enough, she says, you know, those every 3 months as they get closer to the time to go get tested.
Yeah.
I'm getting tested. Yeah.
Yeah, having those moments like, oh my God, what is gonna be? You know, your
Yeah.
lab work.
Yeah. So I keep that in mind. When I know those 3 months testing is coming up, it's like, okay, watch what you eat. They're going to take your time.
Mm-hmm.
You know, I have a question. It's probably going to take us over just a little bit. It just popped in my head because I don't know. Now, I've always heard these tricks about, oh, if you feel like you don't have, if you feel lightheaded, drink orange juice or eat a piece of candy to bring up your sugar. But then there's also something like if you, it's like hyperglycemic or hypo.
It's two, hypoglycemic and hypoglycemic. They almost sound the same, right? One means that your sugars are I'm on both spectrums.
Okay.
If I go too high or I go too low, right? That's my diabetes, right? So when my sugar goes too low, I always keep orange juice in my house. And you know, not drinking like over obsessing drinking a big glass of orange juice, but a small little glass of orange juice will check my sugars back where it needs to be, right? Because I'm starting to feel lightheaded or I have a headache. I also carry in my pocketbook another needle shot for when my sugar goes too low, and I let people know that I have it there in case I'm unable to give myself a shot. And it's for when my sugars go way too low, and I may pass out.
So what do you do if it's too high? It's something you do when it's too high?
That's what I do when it's too low. When it goes too high, that's why I like to monitor. I can see what, like, if it goes past 200, 230, or getting closer to 300. I need to really look at talking to my doctor about maybe I need an increase, or it might be just related to what I ate. Right? Some things just in combinations. I always say, like, I can't have a yogurt and oatmeal together. Too much sugars, right? I need to make a choice. Either eat the oatmeal and have yogurt somewhere for during lunch, but I can't eat them in a combination. It's just way too many sugars, right? So making sure that you're not eating certain foods together that can cause your sugars to go way too high. Being mindful of that as well.
Okay, that's nice. And I'm sorry for the last minute question. It just popped in my head. I've heard it a lot from people who are diabetic about, give me some peppermint or orange juice. I'm like, oh my gosh, this person must be diabetic. And so they're trying to.
And you usually can feel it as a diabetic, as you know, as time goes on, you get used to with like what you feel like. I can always tell without even like monitoring my monitor on my own, like, oh, my sugar is really getting too low.
Yeah.
Right, because I'll start feeling a certain way. And always keeping like that hard candy in your pocketbook, something that's sweet, helps as well when you're going too low. It's really important for diabetics to understand that you must eat.
Yeah.
Right. There's no such thing, let me skip a meal. I need to eat. And I have to have like breakfast, lunch, dinner, small little meals. I'm gonna have 5 small meals throughout my whole entire day. Just to make sure that my sugars don't go too low, monitoring what those meals are so they're not going too high, and I'm not combinating things that make my sugars too high.
Okay. But thank you for sharing those tips for folks listening and those who will watch. And thank you to the both of you for spending these 3 days with us.
Yeah.
Sharing your life experiences, as we stated before in our segments, that we're not medical professionals. We're just sharing our life experiences. But it's always important to talk to your doctor, as this information doesn't replace you seeing your doctor. It's just giving you some information that you guys are applying to your lives living with diabetes. Will always seek the directions of your doctor and have conversations with the doctors for your care. Kyle, any last words before we close out?
I just want to thank you both again for being here. And what is everyone looking forward to the most tomorrow to eat?
Potato salad.
Mhm.
I'm making some beef barbecue ribs, so
Mm.
I'm looking forward to those.
Good. I'm not even gonna tell y'all. You're gonna look at me like, what? I like food, and I am looking forward to my mama's chitlins.
Mm.
Yes, I love the chitlins. So I'm looking forward to that for tomorrow.
And I'm
Listen,
looking forward to macaroni and cheese. I will balance it with some Brussels sprouts, though, per our conversation.
I'll be making that tomorrow in a very small little dish.
Mhm.
So yeah.
Wonderful.
So you all be safe. Enjoy your holiday. Again, those who are watching, please be safe. Please still wear your masks. I know that we're not supposed to gather in large crowds, but if you are, please be safe and practice cleaning your hands. All of the stuff we've been told and know over this pandemic. And so enjoy your holiday.
Yeah.
Until the next time. See
Take
All right,
ya.
care.
bye. Thanks.
Bye.
Bye.
Bye.